Hi everybody, I'm Dr. Amy Kanata and this is Ashley Bratko, and we're here today to talk about post-op total knee replacement rehab for weeks 2 through 4. If you have watched our other video, you should by now be starting to notice an increase in your range of motion, and we're going to talk about the goals for this week along with giving you some exercises and some activities to do not only at home but also with your physical therapist. So Ashley, what are some of the goals for weeks 2 through 4 that patients can expect?
So for weeks 2 through 4, we want to again keep increasing that range of motion. That's always going to be key throughout your entire rehab. We also want to increase your daily activities, the things that you're doing around your house, getting up out of chairs, doing things like that. We want to increase that and keep working on decreasing the swelling that's going along with your knee.
And like with anything, please make sure to check with your surgeon before you start these activities or these exercises and make sure you have their go-ahead. So let's get started with some of those exercises. The first one we're going to show you is an isometric contraction of your hamstring. That's going to help the muscles around the knee as you rehab. What you're going to do is find a chair like this one or one that you have at home, and what you're going to do is just apply pressure. You're going to press your heel into the chair. And you're going to hold it for 2 minutes, and then you're going to relax for 2 minutes. So it's just, you're going to feel the contraction in the back of your hamstring. That's normal. You want to make sure your toes are pointing straight ahead. You don't want any internal or external rotation. And you're just going to press your heel right into the chair. All right, so for our next exercise, we're going to do something called long arc quads. The quadricep muscles are the muscles right here in the upper thigh. The reason they're called quads is because there's 4 of them, and they attach to your knee, and they help you straighten and bend your straighten your knee. So for these, what you're going to do is you're going to also be in a seated position, and you're just going to go ahead and extend your foot, activating these quads. Good. Again, keeping your toes nice and pointed straight ahead. We don't want any turn in of the foot or out of the foot. So for your next exercise, we're going to be doing heel slides. This is a classic knee rehab exercise. Again, you're going to want your toes pointing straight ahead or up to the ceiling. We don't want any internal rotation of the foot or external rotation of the foot. We want those nice and straight. You're going to use a towel to help your heel actually slide along the table. So you're going to pull it towards you, towards your bum. You're going to hold it for 10 seconds, and then you're going to slide it back. And you're going to do this for about 10 to 15 repetitions. And then, like any other activities, 2 to 3 sets to really, again, work those quads and a little bit of the hamstring. So that's it. One other thing that your physical therapist might do with you at this point in time to really help prevent scar tissue from forming and make sure that you gain that active range of motion is some joint mobilization. Now the knee, as we've mentioned before, is actually comprised of 2 joints. One is the joint that's formed from the kneecap and the thigh bone, also called the patellofemoral joint. And then the actual knee joint itself, which is the tibial femoral joint, which actually forms the hinge. So in order to kind of make sure that the scar tissue does not form around and behind the kneecap, one thing that your physical therapist might do with you is just doing some mobilization of that kneecap, where they just kind of gently grab your kneecap. It feels a little bit weird. The other thing that your physical therapist might do is some passive range of motion exercises and mobilization. Passive means someone else is doing it for you versus you doing it yourself. The idea behind this is your physical therapist is going to push you a little bit. You're going to feel a little bit of pain. That's their job. Their job is for you to get back to that full knee range of motion and that full flexion and extension. So it is going to hurt a little bit. That's okay. That's to be expected. Last but not least, this is a 4-part exercise. So it's considered one exercise, but it's 4 different ranges of motion. So for this exercise, it's called a straight leg raise. We're going to be doing it in 4 different planes of motion. And the idea behind this is actually to strengthen these quads using isometric contraction. So the first plane of motion is just straight leg raise, keeping your toes pointed up towards the ceiling. Go ahead and lift your leg. Good, and lower. And like with any other exercise, you're going to want to kind of give it a couple seconds at the top. Let it relax down. You're going to do 10 to 15 reps, 2 to 3 sets. So this is just straight leg raise in flexion. Flexion is the first range of motion. Next, we're going to do this in what we call abduction. Abduction is when your leg goes out to the side. So in order to do this, you're going to lay on your opposite side with your lower leg, knee slightly bent just to give you some support. Again, keeping your leg nice and straight, making sure your toes are pointed straight ahead. We don't want any internal or external rotation of that foot. And then you're just going to lift and lower. Now this is going to target more of your gluteal muscles in an isometric way. A little bit of the quads, a little bit of the hamstrings. Again, 10 to 15 reps, 2 to 3 sets. Your physical therapist is going to push you a little bit. And that's it. Okay, so the next exercise we're going to do is actually called adduction. Adduction. So you're going to be bringing your leg sort of crossing the midline, and it's going to help strengthen the inner thigh muscles. So you're going to be laying on the same side of your surgery, and you're going to be bringing your foot up towards the ceiling, keeping your toes pointed straight ahead. So this is adduction. Adduction. Good. Last but not least, so we got through 3, we're on number 4, plane of motion, extension. So you're going to want to do this on the side of your surgery, and you're going to lay flat, and you're just going to bring, keeping your toes straight, your heel straight up towards the ceiling. You're going to activate those glutes and those hamstrings. This is going to really make your knees strong. Now, if you have any lower back problems, my recommendation would be to roll up a towel, put the towel underneath the front of your pelvis to just kind of put your back in a little bit more flexion and take some pressure off your lower spine. But if you can do this without it, that's great. And again, 10 to 15 reps, 2 to 3 sets of each, and you should be well on your way to getting that knee rehabbed. Great job. All right, so we wanted to show you these exercises with Ashley standing up. So she's going to go ahead and demonstrate the same 4 planes of motion, only standing up versus laying down. Again, it will be a little bit easier, so if you're not ready to do those laying down, that's okay. You can go ahead and do these standing up as well. For our next video, we're going to show you weeks 4 through 8, the goals and some exercises for you to rehab from your total knee replacement. Thank you for watching the video. And again, before you start these exercises, please check with your surgeon. We're really happy to bring you these exercises and we hope you enjoyed.